Hey guys, welcome back. Today I am going to talk about skin. And a lot of people, when I do their makeup, they don't know what skin type they have. I particularly have combo skin. I have majorly dry skin on my cheeks, my nose, and right here between my eyebrows, and I have oily skin on my chin and my forehead. There are 4 skin types. The first skin type is normal. In the professional skin world, there is no such thing as normal skin. If you have normal skin, particularly, you probably have combo skin. According to my textbook that I have, normal skin is skin that contains sufficient moisture and sebum production, displays few breakouts and clogged areas, presents small pores that may be medium in size throughout the T-zone. So for those who have normal skin are those who have flawless skin, your skin doesn't break out, and the reason why you may have normal skin is because your skin density is probably thicker, where you can actually withstand a lot of the environmental damage and the chemical damage and all this stuff on your skin. And because your pore size are not too big but not too small, there's more moisture that come in contact with your skin from the inside. Second skin type is dry skin type. And dry skin type is the skin type I have. Basically is a lack of adequate sebum production. Sebum, let me just go into hindsight what sebum is. Sebum is just like the oil that comes up through your pores, which is important in moisturizing your skin. And for those who produce more sebum, will typically have more breakouts or pustules. For those who don't have enough sebum, the body tend to overproduce during that time that they lack it. That's the reason why people with dry skin also breaks out. People with dry skin also have thin skin, lines of course, and have very small pores. For those who have oily skin, tend to have bigger pores, more sebum production, and have more of a chance to break out, but they tend to not have much fine lines or wrinkles. Those who have oily skin have trouble with their makeup staying on because the extra sebum production is creating that extra layer on your skin, making your face more slippery. For those who have combination skin, has to cater the face according to whenever you're putting on skincare or any facial products, you have to make sure you put it accordingly to the area that needs it. So for me, for example, I definitely have to apply more moisture on my cheeks than any other areas in my face, and with my chin and forehead, I try not to put a lot of oily products on there. And the last one is maturing skin. Maturing skin is loose, thin, crepe-like skin, and it just lacks elasticity. I know that this is a big issue for those who are aging or who doesn't want to have saggy skin, and there are many things out there nowadays, especially with the beauty industry that is booming. You can definitely find things out there that can help you externally, and also with eating, exercising, that can also help you internally. Skin type is so different from skin conditions. Okay, so skin type is basically the outer layer, like everything that is presented physically on your face. Skin conditions are what happens underneath the first layer of skin. So there's 3 layers of skin, so basically it's like on the second, third layer of skin, that's where you have those skin conditions that may cause your skin to react and be all funky. So the first one is dehydrated skin. You can do a test on yourself to see if you're dehydrated, but simply pushing up your skin, and if you push up your skin, if you see fine lines, creasing lines, that means your skin is dehydrated. and this can apply to anyone who has maturing skin to oily skin. So for me, I drink a lot of water. I love water, and I make sure to keep myself hydrated from the time I wake up to the time I go to sleep. So as you can see, I don't have much creasing or anything. My skin is pretty bouncy, and that way you can tell that your skin is hydrated. Cupro skin is basically dilated capillaries, and basically, like, you know, you can have broken capillaries around your nose, around your cheeks, and that is due to trauma to the skin. Like, for example, if you're squeezing a pimple too hard, or you suddenly just hit your face too hard, you know, that can cause a broken capillary. Not broken, but dilated capillary. So be careful when you use anything harsh, like anything with extreme heat or chemicals, because it can cause your capillaries to dilate. That can also damage collagen and everything that is going on in your skin. One of the most common skin conditions is rosacea, and rosacea is basically a vascular disorder. There's nothing you can do about it, but there are ways you can treat it. Basically, it's this redness around your cheeks because of the dilated capillaries, and that causes like red small bumps, and it can happen to anyone, and from small age to, you know, when you're older. Just stay away from spicy food and keep your skin well protected from harsh environments and stress and alcohol especially. Acne is one of the most common skin conditions that can affect anyone from, you know, really young to really old. It's just a skin condition due to an overreactive sebaceous gland. Sebum is the body's natural moisture that produces on you to help moisturize your skin. Okay, so how do you know what skin type you have? One of the most simple tests you can do on yourself is to follow the rule of thumb. So basically, you take your thumb and you place it on your cheek. If your pores is just the size of your thumb, as in like the whole area where your pores are at, that means you have dry skin. My pores are just right here. So I know I have dry skin, especially I have right here and here. The nose have nothing to do with indicating you have dry skin or oily skin. If you have combination skin, you either have a lot of pores right here, right down your middle of your face, or you have it on your chin. That means you have combo skin. And for those who have oily skin, just have a lot of, you know, pores on your cheeks, on your forehead, on your chin. Basically, you have pores everywhere on your face, which concludes that you have oily skin. To determine the thickness of your skin, which is how much your skin can withstand, basically just pinch the side of your jaw like this. You see, I don't have that much thickness in my skin. It's probably like a light medium kind of thickness, and that's probably the reason why I can't, you know, do any chemical facials or anything harsh on my skin or wash my face too much. There are those who do have, when you pinch it, it's like plump, so you can actually feel the thickness from within. My bones is right here, right? I can poke, that's all that is there. So my skin is not that thick, and then that can determine if you can withstand more products in your face, as in your skincare or not. Some other skin type that you may want to keep in mind is that if you do have reactive skin, because reactive skin is totally different from other skin types, for the fact that your skin gets really irritated easily and reacts to a lot of products. When I use too harsh of a cleanser, or, you know, my skin is just red and bad and not good. I hope you guys enjoy this video that I have made. And, you know, skincare is very near and dear to my heart because my skin is a BITCH. So I know a lot, especially because I went to aesthetic school. You know, if you have any questions, don't be afraid to ask me. I will see you guys next time. Bye.